Well, thank you, everybody. Thanks for coming. I hope everybody online can hear me as well as everybody in person. So we've got a room full of people here in Durham, and we've got a large gathering online who are here to hear about the results of the Sling and Carrier Safety Project that we've been conducting. We're very pleased to welcome Jenny Ward from the Lullaby Trust, who's here in person, and Rosie Knowles, who is with us online from Carrying Matters, and they're going to be speaking about their response to what we found. But first, we're going to, the research team are going to introduce ourselves and tell you what we've been up to. So this event is funded by the ESRC Festival of Social Science, and the Festival of Social Science is an opportunity for social scientists, academics, to share our research with the general public. So that's gave us a great opportunity to be able to do that today. The project that we're going to be talking about is funded by the Lullaby Trust and Teddy's Wish. And we are Durham Infancy and Sleep Centre. So I'm Helen Ball, I'm Professor of Anthropology and Director of the Centre. And with me is Sophie Lovell-Kennedy, who's one of the co-managers, Dr. Rebecca Strong, who is the research assistant on this project, and Laura Murray is online, and she is the other co-manager. So I'll get her to introduce herself when we get to the questions and answers. Okay, so the programme for this afternoon, we've got about an hour to talk about the 3 parts to the study, which was a systematic review. Rebecca's going to tell you about that. A parent survey, Sophie's going to tell you about that, and an appraisal of resources and some recommendations that we've come up with, and I'm going to tell you about that. Then we'll have Jenny and Rosie, and then we'll have an opportunity for you all to ask some questions and have some discussion. Everybody happy with that? You will notice, those of you in the room, that we are filming for the ESRC because they like to know what we do with their money. If you would not like to be filmed, please just move yourselves to the back so that you're not in camera shot. Otherwise, we'll assume that you're okay with it. Okay. In this talk and in our project, we use some acronyms, or we use an acronym called AWSC, which we created for adult worn slings and baby carriers. And we use that to encapsulate all fabric slings and wraps and soft structured baby carriers that are used for transporting babies on adult bodies. We're not talking about backpack or shoulder carriers that have rigid frames. Okay. We also acknowledge that not all birthing people identify as women or mothers, so we use gendered language where study data or reports identify the specific participants as mothers or fathers. And in discussing universal adult worn slings and carrier guidance in the UK, which is a country that doesn't have a kind of historic tradition of using baby slings and carriers, we're framing our target audience as those people who lack a cultural practice of baby carrying supported by a community. We're not trying to tell those people for whom baby wearing is like an ages-old tradition what to do. Okay. All right, then. Over to Rebecca.
Yes, thank you, Helen. Yes. Hello, everybody. Yes, I'm Rebecca, and I'm going to present the first stage of our research today, which is a systematic literature review exploring the use of adult worn slings and carriers in infant caregiving. So we peer-reviewed publications from 2000 to 2024 that investigated the use of adult worn slings and carriers in caregiving. We followed a simple protocol, starting with identifying relevant publications through database searching using a specific string of search terms. The identified publications were imported into a software for screening, and this is where duplicate titles were removed, and we also evaluated the articles against our inclusion criteria, which is just listed here. Publications were only included if all of the criteria were met. And finally, we extracted key information from the article. So this included information such as who was carrying baby, where on their body were they being carried, and what type of sling or carrier was being used. And finally, the extracted data was analysed and synthesised into some research themes. In total, 3,000 361 publications were retrieved by database searching and through citation mining. So citation mining is where you go through the articles you've already found and identify the relevant publications in the bibliography. 97% of the articles were ended up being excluded, and this is because they were either duplicates or they didn't meet our inclusion criteria. So in the end, we ended up with a total of 73 publications for data extraction. And from these articles, we identified two main themes: benefits and motivations for the use of adult worn slings and baby carriers, and also the potential risks associated with sling and carrier use. So 47 of these articles were associated with benefits and motivations for the use of adult worn slings and baby carriers, and they were split into 4 topics. The majority of those were associated with the positive impact and benefits of using slings and carriers, so demonstrating a positive health outcome for infants' physical health as well as social development. 16 articles looked at parental beliefs and perceptions that demonstrated adult worn slings and carriers promotes bonding and secure attachment while helping to soothe infants and reduce crying. Slings and carriers were also shown to have a positive impact on parental mental health, decreasing anxiety and increasing confidence, especially in mothers. And the last 2 studies looked at the how and why carriers and slings were used by parents. 26 articles looked at the potential risks of using adult worn slings and baby carriers, and these articles were categorised into 3 different topics. So 13 looked at the negative impact on maternal physical health, with experimental work demonstrating that carrying infants can cause changes in gait and posture, with prolonged carrying causing fatigue and pain. Next, there were 11 articles that looked at the risk of infant death or injury when using a sling or carrier, and 2 main risks that were identified through information gathered from different hospital records and databases. So the first one is falls, and that can be associated with either an infant falling out of a sling or a caregiver falling while baby wearing. And the second is positional asphyxia, which was the primary explanation for infant deaths in adult worn slings and carriers, particularly with infants under 4 months. However, determining the leading cause of death was challenging in some of these cases because there was a lack of physical or clinical evidence that accompanied it. And finally, 2 studies looked at the harm to infant health. So this looked at cardiorespiratory destabilisation and looked at temperature changes associated with wearing a sling. It's also important to note here that while slings and carriers can help promote healthy hips, slings and carriers that have a narrow base don't promote that healthy hip position, so it can pose a risk. So the key findings here is that we have clear evidence demonstrating the benefits for using adult worn slings and carriers for both parents and infants. There is evidence that adult worn slings and carriers use can be associated with infrequent accidental infant deaths and parent physical discomfort. And there was a gender bias present in the literature, with research primarily focusing on mothers or females and only 1 article actually looking at fathers. And it also highlighted a few areas where we lack research evidence. So one of those was the uptake and implementation of safety guidance. Another one was looking at the duration of sling and carrier use and the impact on those benefits and risks that we've identified in the literature. And then the last one is the long-term impact of baby wearing on adults' physical health. So that was what we found from the systematic literature review. And I'm going to pass on to Sophie, who's going to talk about the parental survey.
Thank you very much. So with the survey, we wanted to assess 3 main things. So how do I how and why do parents choose adult slings and carriers, and how do they use them? What do parents know about slings and carrier safety? And what are parents' awareness about sling guidance and their sources of information? We designed the survey in collaboration with the parent advisory group. This was just to sense check it and make sure everything made sense, it flowed properly, and that we weren't missing anything really obvious. So if any of the parents are either in the room or online who took part in that, thank you very much, because it was really, really useful for us. In terms of how we disseminated the survey, we distributed it online via the BASIS and DISC email lists and our social media, and those of key professional organisations and charities associated with infant healthcare, and other people then shared it further on from that. So again, if you're one of those people who shared the survey, thank you very much. We had a massive response, much bigger than we anticipated. We were hoping for maybe 300, maybe 500 responses if we were really, really lucky. In the end, we had 1,470 eligible responses. Some responses we excluded because they were duplicate responses, they were incomplete. The infant was over 12 months. But we had this massive number of responses and a lot of data for us to kind of wade through, which was excellent. 95% of our respondents were white British. 99% were aged between 26 and 45. The majority had used a sling with their current baby, but we did have a handful who hadn't used a sling. And most of these respondents were resident in the south of England. In terms of when and why people chose to use a sling or carrier, most people had decided they were going to use a sling or carrier before they'd given birth, either before pregnancy or during their pregnancy. And most people started using a sling in the first 3 months of their baby's life. In terms of the reasons why people chose to use a sling or carrier, there wasn't one reason that really came out as the single reason why people chose to do it. It was for a number of reasons, but it was these 3 reasons that really kind of were most common. So it's freedom of movement, bonding and soothing with baby, and helping baby to actually fall asleep. Like I said before, we didn't have a massive amount of people who weren't using a sling or carrier who actually responded to the survey, but we did have a handful. Not enough for us to do any kind of comparative analysis or anything kind of too complicated with statistics, but enough for us to say that the reasons why people were choosing not to use a sling or carrier was because they were concerned about safety, or they were concerned about the appropriate fit for them, the carrier. In terms of what types of slings people were using, this varied quite a bit by age. So I put both our 6 to 12 age group and, 0 to 6 age group and our 7 to 12 age group. As you can see, there are a lot more responses in the younger age group. What we also found was that 54% of carers used multiple slings depending on how old their baby was, because of when their babies were bigger, when they were heavier. Primarily different types of slings were used for parental comfort. The most popular type of sling across all age groups, as you can see, was a structured carrier. But in the younger age groups, and in fact both age groups, wrap slings were really popular as well. We found that what was quite interesting for new parents, structured carriers were more commonly used. For experienced parents or parents who were born before, they were more likely to use a fabric sling. So that's a wrap sling or a rain sling. Pouch slings were used by a handful of parents in all age categories, which is obviously a bit quite concerning that they are still being used, even though there is a high potential baby being in an unsafe position whilst in one. In terms of the difficulties that parents or carers face when baby wearing or when using a sling or carrier, no matter if they were new or experienced parents, the difficulties were the same. So 59% said they struggled with how to position baby properly. 42% they struggled with getting baby into a sling or carrier. 58% said they struggled with getting their sling or carrier comfortable for them to wear. And 34% said they struggled with fastening their sling or carrier securely. Now, onto that, I'm very aware of kind of time, but when we say we had a lot of data to cover in this survey, it was amazing because we had so much to do. And this is only really a snapshot, and we will send out the report afterwards that kind of gives you even more information. But in terms of the safety guidance and what parents and carers actually know about it, We found that guidance at the point of purchase was really lacking, and therefore we're relying on parents finding their own information and being able to navigate often an online world of a lot of information that's out there. So over 50% of our respondents had purchased their own Sling, and 2/3 of those had purchased it online. Only 3% of those, you can see, this is the 3% that actually received any guidance about how to use their Sling correctly, how to choose a proper Sling for them. And around 30% of those who brought their own Sling had brought it in store. And again, the majority of these had not received any guidance about what was an appropriate Sling for them and how to use it safely. Only 15% of our respondents had hired the Sling via a Sling library or got their Sling from a Sling library, but 76% of those who had done received information about how to choose an appropriate Sling and how to use it safely. Which, yeah, I think is quite a worrying one for us. In terms of what guidance, safety guidance there is, and how people are using it, parents were generally aware of the TICS guidance. And just under 2/3 of respondents said they thought there were enough resources to allow them to make decisions about using a Sling or carrier, but 40% didn't think there were, or they weren't sure if there was enough information out there. Like I say, parents were generally aware of TICS and followed the TICS guidance, but around a quarter of those who knew about it felt like there was something missing. And of the people who felt there was something missing, 3/4 said that it was something to do with how and when to wear their baby. In terms of who people trusted to give advice, new parents trusted the NHS and charity websites, and experienced parents trusted baby wearing websites specifically, or Sling libraries. Despite trusting NHS as a source for baby wearing, less than 1 in 5 people actually thought that health professionals were qualified to give them any information about baby wearing. And again, social media was a really popular source of information, but it was also the least trusted as a resource, which I thought was quite an interesting kind of comparison. And nearly 30% of respondents had received conflicting advice about slings or carriers in terms of age, weight, and height ranges of babies in different types of slings, or whether or to world face ever in a carrier or not, so face outwards. And I'm going to pass over now to Helen.
Thank you very much. Okay then, so I'm going to spend a little couple of minutes telling you about the critical appraisal of the resources, information that's out there, and then tell you kind of like what sense we made of all of this. So the last phase of the project aimed to appraise publicly available information about adult worn slings and carriers. We used something called a FOSS evaluation, where we just scored these things for completeness, clarity, correctness, and credibility. There were 3 sources of information that we looked at, and totaled 85 different sources: charity and professional organisation websites, website and manufacturer instructions for the top brands for 2025, and any resources that parents had mentioned in the parental survey. We looked at all of those. 2 researchers scored each source, and a 3rd researcher arbitrated. And we found of the 85 resources that we found, 19% of them were referenced by parents in the survey. And of those, 6 were brands, 1 was a retailer, 4 were professional organisations, and 5 were baby wearing websites and blogs. So in terms of completeness, most of the sources mentioned airways and accidents, but fewer than half mentioned hips and spine, and only 15% mentioned clothing and temperature. 46% of the resources provided a kind of useful explanation as to why parents should consider the issues that were raised. Only a small percent of them had incorrect or no safety information, which is fairly reassuring. It was only 6 out of the 83. 64% of the sources were rated poor in terms of clarity, and the vast majority of the poorly presented information came from manufacturers, which is one of the places that people are turning to for their information. In terms of the credibility of the information provided, a rationale was provided for about half the examples, but 68% of the sources made absolutely no reference to safety guidance, academic literature, or the qualifications or credentials of the person providing the guidance. So we concluded that the current guidance is fragmented and incomplete in the UK. While there's some very detailed and helpful information in some locations, it's not widely highlighted or signposted to parents via the places that parents go to look for information. So there's some joining up needs doing. And we came to the conclusion that we need a single nationwide set of guidance to raise awareness about safe sling and carrier use, to alert parents to the key issues about baby safety, and to direct them to the more specialist sources for tailored information and support. So our recommendations then start with exactly that all parents, whether they plan to use a carrier or not plan to use a carrier, should receive clear and consistent information in pregnancy or early infancy. As you've heard already, 30% of them had received conflicting advice, 25% had never heard of ticks. There was a wide range of variation in the guidance that's out there. So it's imperative really that infant safety and Sling organisations work together to produce and share a set of information about safe sling and carrier use that's clear, consistent, accessible, usable, and focuses specifically on infant safety. So I've given a few definitions of what those things mean there, but I think you can probably work it out. Any new guidance, it's really important that parents are informed about positioning and monitoring, particularly when babies are feeding or sleeping. One of the things that we found in our survey was that parents use hands-free for mobility with physical contact as a reason why they baby wear. But there's no research out there that informs how you might monitor your baby while they're feeding and sleeping, and whether hands-free for a baby under 3 months is a safe thing to do. So we need to collectively work on some guidance around that and how to actually, in practice, do close monitoring for the youngest and most vulnerable babies. The falls were the greatest cause of infant injuries with sling and carrier use, and that happened when babies were being carried and the carrier failed, or the fastenings failed, or when babies were being put into the sling or carrier and parents were struggling with that. And some of that was to do with poor product design in the studies that we reviewed, breakdown of the product integrity, or to do with improper use. So parents need information about reducing the chance of them falling while they're carrying, and not undertaking activities that they wouldn't undertake if they were carrying their baby in their arms. Fourth recommendation is about when parents get this information. So as we saw, before pregnancy and in pregnancy is when most people decided to use a baby carrier. So it would be really valuable if parents got that information early via posters in clinics or leaflets at hospitals or electronic resources that are distributed via midwives and health visitors. And we would strongly encourage that all those different avenues provide exactly the same safety guidance, so parents are getting the same safety message, whichever way it's being delivered. So lots of caregivers carry babies. It's not just mothers. There was very little that was about size and shape of the adult doing the carrying. So if we're having universal guidance, that's obviously got to cover everybody, and will require signposting to people who can help parents get an appropriate fit for their body, especially if a carrier is being passed backwards and forwards between different people. Many users weren't familiar with the TICS guidance, as Sophie's already told us. They felt the guidance needed to be more memorable. We feel as though a universal safety campaign should incorporate at minimum the NHS website and other websites commonly accessed by new parents, that health professionals should be familiar with basic safety guidance and signposting, just as they are with basic sleep safety information. and that the information should be shared by multiple social media platforms, simply because that's where most people get information these days. Parents lacked awareness of the organisations that can support them with adult-worn slings and baby carriers, and they need information that they can trust. So the guidance needs to emphasise that specialists exist, signpost to how to find them, and ensure that any guidance that's given is accompanied by explanations so parents know why they're being told to do what they're doing, and that the information is trustworthy. And then the pouch sling issue. Some parents were still using pouch slings. Some parents were making homemade slings. So one of the things that we need to emphasize is that pouch slings aren't safe because of positional asphyxia, and homemade slings should be used with caution. We don't know what kind of slings people were making. But pouch slings would be very easy to make, actually. And finally, information provided by manufacturers, as we noted, scored poorly in the appraisal, and parents who relied on manufacturers' guidance alone were unlikely to be alerted to the risk of positional asphyxia with improper use. So those parents need that information. We would like to see manufacturers include consistent safety information, the same information that will be given out by the NHS, etc., if we manage to pull that off. And we would strongly argue that retailers and manufacturers shouldn't sell products that can't comply with this guidance. But from our knowledge of the infant products world, we suspect that they're still going to be available, so parents need to know what to avoid. Overall then, parents want information about baby wearing topics, and they want information as well that's unrelated to immediate infant safety. They're concerned about lots of things like overheating, positioning of baby's hips and spine, the risk to adults of pain and fatigue and discomfort. So we would suggest that the core safety information focuses on just that. There are no studies out there that indicate that babies have died due to overheating while being carried in a sling or a carrier, but parents need advice on how to check their baby's temperature, for instance. Concerns about the baby's hips and spine, adults' pain and fatigue, they're not infant safety risks, so they should be directed to the specialists rather than trying to put everything into the safety guidance. And then there were a few further questions for research. So parents had questions about carrying duration. There's no research evidence about that at all as to how long, if there's limits on how long you should carry a baby of a particular age. How they should manage infant temperature and clothing. There's no research been done on that. What parents should consider when choosing a sling or carrier for use with different adult bodies. Are there some that are easier to adapt to different bodies than others? And of course, we have no idea whether parents will implement guidance about sling use for young babies when feeding and sleeping. So whatever we do, we need to kind of monitor what happens and whether parents are taking it on board.
Thank you. It's great to be here. And just as an introduction, my name is Jenny and I'm Chief Executive of the Lullaby Trust. And we are a charity that probably is well known for giving safer sleep advice, but actually our remit is a little bit wider and we cover baby safety a bit more than that as well. And we also offer bereavement support. So we give a lot of information, and it's predominantly, it comes out usually after a baby has been born. I think that's where our advice probably comes out, but we've tried to move that a bit more. So really interesting to think about products and when families might make a decision on what they use, because that shows that we need to make sure we're pretty early. So I think it's all firing up, and you'll see I've only got a few slides. But just to say, we're here, we fund research. So we, along with another charity called Teddy's Wish, I'm absolutely thrilled to have funded this research. And that is, it's coming back.
Online, you can see the slides.
Okay, right. So if you're online, you're lucky you can see the slides. In the room, we're still firing up. So you're a step ahead of us. So as a charity, we're here to really, one of the things we want to do is to support bereaved families and also to understand why babies might die suddenly and unexpectedly. So there's two parts to this, and obviously we have a lot of prevention work to try and prevent the sudden and unexpected deaths of babies. So back to 2023-24, we ran a small grants round, which is what this has been funded with, along with Teddy's Wish as well. And so we put out expressions of interest, and they were based on a much wider project that we'd done a few years ago, which was a global priorities project, which looked at those areas that where there wasn't enough research. And that's what we've been focusing ourselves on. So this wasn't a large grant round, but it was going out there and saying, these are the areas. So the ones that you can see, these are the areas that we think we'd like to see more research on. And that's how we began to fund this project. Doesn't want to move now. Can't seem to change the slide down. Yes, there you go. Right, so the Sling and baby carrier safety was an application that we got from Durham University, which is brilliant. And it came in at the same time that we have been supporting a couple of families who very sadly had a baby who had died in a sling or a baby carrier. And they were families who had looked a lot at the advice, and it really follows it. It's really interesting to see all the results from the survey, because they followed what we had learned as well. It's doing its own thing for some reason, which, yeah, I don't want you to see that slide. Yeah, there you go. Sorry, they had followed exactly what families had said to us, which was, there was a bit of advice out there, but it really wasn't that clear, and we didn't fully understand it, and it came from different places, and we didn't think we'd done anything that wasn't outside of that research, which was exactly the case. We realised that there was a gap there. So we have been working with those families and with a number of organisations as well, because I think this covers, it covers the safety of infants, but it also covers products, and it also covers feeding, and it also covers how parents look after themselves and their own welfare. And lots of different charities and other organisations cover all those different things. So it's actually a really interesting topic that is not just one that we in the Lullaby Trust can or want to take on. We want to work in partnership with them. So we've put here, and actually, without knowing exactly what you were going to say, that we were told that the current TICS guidance was difficult for parents to understand and didn't always fit with the products that they were able to buy and the lifestyle that families were living under. So they wanted something a bit more. So what we did, it only was, no, it doesn't like me. Okay, did it. So what we did in advance of the research being done, so obviously we've worked with the team, but we were already thinking there are a number of other organisations and people who need to come together and need to think about where we're going to go forward when we do get some advice, when we realise what more we want to do. So even without knowing what the recommendations were going to be, we already knew that one recommendation was we need to be a bit better in this advice. And I really want to, at this point, just say that the families who have been bereaved, who work with us, have done an incredible job. And they have really helped us to engage so many other people, and going out and talking about something that is so difficult for families is, you know, it's just incredible. So that's obviously been something that's really taken taken us all. Sorry, it's just doing its own thing. If you're online, I apologise, it doesn't follow what I'm doing. So what we did was we've gathered a number of organisations, and the middle paragraph you can see gives the examples of those, and they're really wide. So some of them are ones that the Lullaby Trust knows and works with really well, and others are ones that are a bit wider, things that we haven't necessarily worked with all the time, things like trading standards. OPSS is the Office for Product Safety and Standards. So we're looking not just at the advice that goes to parents, but the advice that goes to manufacturers, the regulations around that as well. And also that group that I think has already been touched on, which are those experts who know about and work directly with families who want to do baby wearing. So we've put this group together, and we had a first meeting, I think it was in September. It was hugely positive. It was a really big online meeting. You know, when the windows just take over, it's probably the same if you're in that kind of meeting right now. There were loads of us in there. It was really, really positive. And the point of the first meeting was, do we all have the same priority? Do we want to come out of this and get more advice and make sure that it's better and clearer for families? And that was a clear yes. So what we're going to do next got to use my fingers correctly. We have another meeting, which is going to come obviously after we've had the results from this one. There are some additional groups, so even when we had this really wide group, there were still others that they said it'd be good if they were involved as well. We're trying to make sure that if you're a family and you have a young baby, or you're a professional who works with families with young babies, that we've got hold of you in one of these groups, and you're going to get this advice in some way or another. So that's like the first stage of it. And then it must be on a timer. And then once we've got this final report and we'll share that, we'll then start to think about that guidance and what it looks like and how we can get to an agreement of something that is as simple as possible that we can get out to families, but that we can also have more detail that's there as well. So we're looking at that in early 2026. It's gone really quite quickly, probably not for those of you reading all those papers and the surveys, but for us it was amazing to see how many people wanted to fill in that survey. And we thought, okay, we've chosen the right research project here. Absolutely, this is something that we need to do. So looking forward to the next steps. So thank you.
Thank you.
Yes, hello. I'm very sorry I couldn't be there with you in person. I do have some of my representatives here in the room, so that people want to talk or get some direct information from Alex, she's there. I don't have any slides, I'm afraid, because I'm at work and so I'm doing this up in between clinics. I have a lot of thought about this. First of all, I am thoroughly delighted that this is in process, because we've all known for a long time that there's been a general lack of clarity and cohesion about supporting parents with safe sling use. I'm really pleased that it's come out so clearly from this that there's definite benefit to families from using Sling, and that we all have this great desire to want to improve the safety and the outcomes from this. And it's really good that more big organisations like the NHS and Lullaby and everything are recognising the importance of supporting families with slings rather than leaving them to have to work it out for themselves. And it's also very obvious that when people have access to education, to clear information and support, the outcomes are much better. The risk is reduced when people are given the support that they need. Families carry more confidently and they carry it longer. And they quite often have effect on their local communities, bringing other people into information resources. So this has really positive impact on social outcomes. And I also want to point out that I very much recognise that we live in an evidence-based culture now. I work within the NHS. While it may be very obvious to some of us that this is normal behaviour, is what families have been doing for generations, living in an evidence-based culture. This is now what's needed of us, so we have to engage with research and ways of being able to prove what we may know to be helpful. So I'm really pleased that this project is happening, and I'm really hopeful that it's going to be really useful. And hopefully there are other organisations around the world doing similar things, like the IPSIC, for example, which is European based. They've been doing a lot of studies and research, so hopefully we can all collaborate on this. I think some of the key factors for me that's coming out of what you've done so far is that, yes, absolutely, manufacturers need to take much more responsibility about what they're doing, what they're selling. And one of the real challenges we have with that is that there is no regulation of this. Anybody can make a carrier and sell it. Yes, there are sort of safety standards, but many carriers don't use that. All you have to do is to go onto Amazon or Temu and you can buy stuff for £5. This clearly, utterly inappropriate. Of course, it may be very clearly obvious to you and to me and to some people, but to a new parent who's tired, overwhelmed, can't afford a good carrier, can't afford to make use of an expensive consultancy service, for example, they're just going to buy it. The instructions aren't used fit for purpose if there are any, so they try it. It's unsafe, it doesn't work, they give up. So yes, we absolutely need to hold manufacturers to account for their laziness, I think, in a lot of cases. We do have some manufacturers who work really hard to make sure that parents are given adequate information, really good leaflet, providing YouTube, but they tend to be specialised manufacturers. So it's very different sort of going into, say, John Lewis, where you might be given a carrier and the salesperson doesn't really know anything, as opposed to going to a specialist shop where you've got someone there who's actually going to be able to show you how to use it. And quite often these manufacturers, if you're selling into a specialised shop, the people working in the shop do the work of ensuring safety. So yes, manufacturers have a lot of work to do. I also agree that the ticks is helpful, but is not enough on its own, and it's something we've been aware of for a little while. For example, as Sophie pointed out, it doesn't talk about the issues regarding temperature. For example, it doesn't talk about the difficulty with knowing is it safe for a baby to sleep in a carrier. It doesn't comment about issues regarding the increased risk when it comes to feeding. And so the text is very useful, but it's not enough on its own. And so the idea of the campaign and new guidance to bring all these things together is going to be really very welcome. And the fact that it needs to be understandable is really important, because I think we forget just how difficult it is for new parents who are overwhelmed by so much information, and also overwhelmed by the sheer impact of being a new parent. It's hard to decipher small writing, images that aren't really all that clear. So I think this could be really, really helpful. And just, and if you want to see some of the resources that some of us are coming up with, you can go and find Alex in the main room, or you can go to various websites, including my own Carrying Matters, which has safety information for key areas, which if I'd had time, I'd have put into a slide for you. But that's easily available if needed, and I'm sure Sophie will disseminate it later. Another thing that really obviously coming out of this and is really clear is that so much more needs to be done by the people who have access to parents at that point of contact. So this comes down to people working in antenatal or postnatal resources. You know, absolutely we can't expect antenatal clinics or midwives or health visitors to know a great deal about slings or to be able to fit them, but I do think they should know about them. They know about their local sling libraries, know about the resources available, so they then can direct people to that. And I'm also aware that sometimes there's a bit of an issue when it comes to the NHS saying, oh, but we can't signpost to private businesses. And I think that's the real issue, because the NHS works with private businesses all the time. It buys medication from pharmaceutical companies, it uses laundry services. None of these sling libraries with their small business hats are going to be gigantic profit-making enterprises. They've all been set up by individuals who benefited enormously from slings themselves and have this huge desire to share that with other people. None of them are making gigantic profit at all. Most of them are voluntary. Most of them will have free resources for people who are available. And so this is where I think actually getting more public bodies, getting more councils, the NHS, all these people involved, because ultimately libraries would be able to provide even more free help and resources to people if their local NHS and the local councils were behind them. What about asking council to provide free venues? What about asking council to signpost to libraries? What about funding for libraries? Because what we all know in libraries is that a lot of the people who come to see us are in many ways self-selecting. They come to us because somebody's told them about them. They may come and see, oh, but I've got to pay £5 or I've got to pay £25, you know, and that's very off-putting. But sling libraries do this with minimal income, and so some way of funding them to be able to be a public service would go a huge, huge way in order to be able to provide support for the unreached who won't come to use sling libraries. So I think there's a huge amount of work to be done, and I'm really hopeful that's going to come out of all of these ongoing meetings. How can all these organisations and these bodies work together for the benefit for new parents, especially the most vulnerable who won't bring themselves to resources? So family centres, council, the NHS antenatal services, postnatal services, all of this. And there are already examples of something like this happening. For example, the baby box wrap in Scotland is funded by the government, and the government are working on making really good videos, making really good up-to-date information about how to use this safely. And I mean, we're encouraging them to make connections with local libraries, so when the wraps are given out, people are automatically signposted to someone who can help them. And the social impact of something like this is going to be enormous. They'll be fitted properly. The risk will go down. People will get that information about the risk of feeding in Sling, the risk of sleeping, answer questions about, oh, what aid can I use this for? And that one of this potential side effect about having a safety campaign is brilliant, because it will just arrange increased awareness. But what it can't do is give people personalised information, and that is one of the issues, because everybody's baby is different, everybody's baby's size, their vulnerability, their body shape is different. So this is again why you need one-to-one or personalised support, just like you do with breastfeeding services. And if the council can support breastfeeding support, maybe they can also think about funding baby wearing support to reduce this. So what could libraries do to help? Well, I think libraries already do an enormous amount, but with more funding and more support, they could potentially do a great deal more. I think NHS bodies need to be more willing to support. I think they need to be more willing to signpost and potentially consider having good leaflets from any national campaign available. I think we libraries can also potentially try to be a little bit more cohesive in what we offer. I know there are efforts being made to try and create a network of libraries, an educational network, the baby wearing educational network. Work is ongoing, it's very slow, but that again, because of the voluntary nature of this and the difficulty there is of trying to sort of bring all this under one umbrella, but we are trying to do that. And there are training schools available, people are required to have insurance in order to be certified. And so again, it's just about information sharing and encouragement. There's a last couple of things to think about. There is a CIC called the Building Bonds Project, which some of you may be aware of. They've now got national lottery funding, which means the people who can't afford carriers or couldn't afford or get to a local Sling library can apply to Building Bond to be given a free carrier, fitting support if required, or signposting to the local Sling library. So that already having quite a significant impact. You know, homeless people, people with mental health issues, asylum seekers. You know, projects like this can have a huge impact if they're properly sort of supported and funded. And another thing I want to raise is there are, I can see from the chat function going on, quite often mums, particularly mums, are really keen to do things to support their mental health, so they can often get involved with dance classes or fitness classes, and that I think is another area of potential harm that hadn't been covered in the guidance yet. So that's something I'm going to be bringing up at next meeting, is the mums go and buy cheap carriers and they go to dance classes or fitness classes where the person running the class has no information or knowledge about how to use a sling safely. And so you can see how lack of information can cause harm. Babies being sort of jiggled about in carriers unsafely, and the difference between carriers and classes that have training and classes that don't is very obvious. So I think that's an example of how the right kind of information with the right support and the right training could be really helpful. There are already NHS trusts who've already invested in getting some of their staff trained, and they're having a huge impact. And I do recognise that that's not something that's going to be available across the NHS on a wide level because the staff turnover is high. There's not necessarily all that funding, but I do think that on a basic level, getting everybody aware and signposting and proper funding would be hugely influential, and I'm really hopeful that we're going to be able to make those steps together.
Thanks, Rosie. Thanks very much. That was really helpful, and I think, yeah, we're just at the beginning of this journey here. Interestingly, the baby wearing exercise classes didn't come up in the survey, did they? So that's something that we need to add into the mix and think about. Yeah. So I'm going to give